Welcome once more to this particular module. We are discussing positive pregnancy experience. And for you to have a positive pregnancy experience, you need to understand your body changes. So what body changes do you anticipate? If you're in the first trimester, you've just discovered you're pregnant, of course. You had enough that pregnancy comes with nausea and vomiting, and sometimes cramps and sometimes bleeding. If you're bleeding, please go to the hospital. But there are all these things that you're told about and you've at least heard from your neighbor or someone. So what do you anticipate? You're a new mom. What do you anticipate when you asked about pregnancy? Number one is to know that your body will change. Your body is an incubator, and therefore as an incubator, the things that it has to do to be able to cope with a new baby. And the first thing that will happen, your body is releasing hormones so that it can support the pregnancy. And these hormones work across your entire body to change your normal body functions. For example, your breathing changes. You breathe deeper for longer, right? Your heartbeat changes. It becomes faster. Your blood pressure drops actually. So that there's more time for circulation and the placenta is able to get enough time to interact with the baby's blood and pass on the nutrients, okay? So you actually get more oxygen, more blood flow during this time, right? And then the changes to your skin. You will find that you become darker or lighter, or you'll get acne, or you'll just glow. We have this thing we call a pregnancy glow. And some people will tell you, oh, girls will give you a glow, or boys will drain you. Really, it's neither here nor there. But your body is able to have more cells that will, for example, darken you, especially if you're of our race, all right? And all these are changes that will affect you. And because it's a surge of hormones, you will find that your body will actually start dynamically changing. Your back is going to move forward so that it can accommodate this new baby. Your gut motility or your intestines slow down as progesterone is running in your body. And as they slow down, you may find you get constipated, you get gassy, you'll find that it's taking you a lot longer to pass stool. Yeah. And that can be quite irritating. And then if you lie down, you may have we call it the sphincter of the stomach, or the gates of the stomach may open or are not as strong as they usually are outside of pregnancy. So you may get reflux, especially if you lie down flat, right? So all these changes cumulatively will give you the things that we describe in pregnancy. For example, nausea. For example, vomiting, hyperacidity, constipation or bloatingness. It may give you sleepiness, especially in the first trimester. You will find that you're very, very tired and very, very sleepy. And if you can look at it critically, a new baby is forming, which means your body's energy stores are being taken to help this baby grow. And between the first trimester, from 3 weeks to 8 weeks, and then from 8 weeks all the way to somewhere 14 weeks, the body is fast forming new organs and then starting to allow those organs to look like what we do look like as humans. So metabolically speaking, there's a lot of energy that is required from you in this first trimester to support this baby. If you look at it hormonally, if you look at it immunologically, there are a lot of changes that are happening to be able to allow this baby to grow and develop normally. So what does that mean for you? It means that One, you need to change your diet. You need to really change your diet. And the most basic supplement you require at this time is folic acid. Why? Because folic is one of the most metabolically active ingredients in the body. Okay? It is useful in formation of DNA, but most especially we need it for the formation of the brain tissue and the nerve tissue. So if you know this, then you know you need to eat foods with folic and actually take folic acid. You will realize your body knows what to do. Personally, in this pregnancy, I craved a lot of hard-boiled eggs before I knew I was pregnant. Like I was eating so many eggs that were boiled. Didn't want any other, not fried, no nothing, just boiled eggs. Only to come and read and discover that boiled eggs are a very high source of folic acid. So once you discover you're pregnant, please, number one, take your folic acid. Just take your folic. If nothing else, just take your folic acid. You don't need to start on iron now. It may give you worse nausea than you had before. The hormones that are raging in your body that are very nausea prone. So you just start with plain folic acid, right? And then if you are taking alcohol, if you're taking caffeine, if you smoke, this is the time to just leave it alone. Why? And if you are on medication, actually. So smoking, alcohol, caffeine, but especially smoking and alcohol, they literally affect the cell developmental stage. And I've told you in the first trimester is when the baby is forming. So what does that mean? It means that if your blood as a mom takes up this we call them teratogens. Then they go to your blood. Then they go to the baby. Then the baby is going to develop with having fetal anomalies or congenital anomalies. But if they don't, they're prone to have DNA changes that predispose them to having cancer towards later on in future. And of course, you don't want that for your baby. All right? So please just avoid. It's a 9-month window and maybe 6 months of breastfeeding, and then you can go back to your lifestyle if it's really as important. Okay. 2 is drugs. If you're taking hypertension medication, diabetes medication, hyperthyroidism medication, psychiatric illness medication, seizure medication, and all those things, or depressions and the antidepressants, all this medication, whatever medication you may be on, this is the time to go to your gynecologist and tell them, I've been on this. Together with your physician, it will be changed to something that is helpful to the baby or that will not harm the baby. So no, we're not going to get off the medication completely. No, you're going to go to hospital and then you're going to change the medication with you so that we can optimize your body better for the baby. Okay? Then food. Eat well. Eat for one, but add 2 snacks. Okay? And as you're eating, in the first trimester, you may realize the portions are little. Why? Because you're unable to hold food down. That's fine. Small meals make a difference. So you don't have to eat a whole plate as if you're eating a king's breakfast. We can have small, healthy meals throughout the day. Just make sure your food is well balanced. It has starch, it has protein, it has a vegetable. We advise in the first trimester to avoid pineapples and pawpaws. Okay? Why? They release an enzyme that can cause uterine contractions. So if already you have issues with the attachment, then that can bring an issue. Okay? So avoid it in the first trimester. You can perhaps eat in the second and third trimester, but I would just advise avoid it. Okay? No matter how much your body screams for it. Okay? That said, too much of anything is dangerous. For example, if you eat a lot of salt, you're predisposing yourself to getting hypertension, you're predisposing yourself to getting kidney injury. So just limit how much of that you're taking. I've been asked, is tea safe? Right, you can take tea, but make sure it's among the healthy teas. Okay. The people who have reported, if you take, is it hibiscus tea, that it can trigger contractions. So just read through what teas are safe for you and what is not. But the usual African tea should be fine. Black tea should be fine, just in normal quantity. You're not overindulging in anything. Okay. Sugar as well, don't overindulge. If you're taking 40, that's it. Don't go get a whole bag of, pat cores. And I know that because I've done that. And now managing diabetes in pregnancy. And I'm not saying that it's a cause of diabetes in pregnancy, but it does help when you have less processed sugar within your body. Okay. So I think that's what I'll say about diet. But as you understand these body changes, in second trimester, you're going to get to 20 weeks and then you'll start feeling flutters in your tummy. Or if you're second or third time mom, it will happen earlier. And you know that's your baby moving. Okay. And it's such a cute feeling because you're not so sure if that's worms or butterflies or just a baby. It's just an interesting place to be at. But second trimester is literally heaven. It's literally heaven. You forget everything about the whole pregnancy, apart from maybe sleep if you get issues of insomnia. But then in third trimester, remember your baby is becoming bigger and you're also becoming bigger weight-wise because there's a placenta there that weighs a kilo. There's fluid for the baby. There's the baby themselves. So that will make your body push forward so that there's accommodation of this new weight on your back. So you may start feeling back pains here and there. You may start feeling leg and thigh pain. If you get any of that, just talk to your doctor. The medication that we give you, it's the exercises that we guide you to do so that it's comfortable, it's bearable. All right. But in third trimester, you may experience that type of fatigue of you walk a distance and then because the baby is up here, you feel like you can't breathe. Yeah. But beyond that 6 weeks, once the baby drops down, literally that heaviness of breathing should relax. And then now you'll just be left with this thing down here that you're like, what is this thing down there? It's the baby's head. You may press on your bladder. You may need to pee more. But if you understand why, then it's something very, very, very seasonal. And it literally very short window. So nausea, vomiting by around 12 weeks should be done, like completely. Unless you have hyperacidity, which should be controlled. Second trimester, bliss. Feels, that's the issues, you feel really nothing. Third trimester, you start feeling the weight and the tiredness, but it's towards the end. And then it's time to get your baby. All right. So all these body changes, of course, will affect you. Of course, will make you feel like you're exhausted. But remember, if you feel tired, you're allowed by anyone in the world to rest. Right? If you're in the first trimester and no one else knows you're pregnant, but you know you're pregnant and you're feeling tired and fatigued and all these things, take time off and rest. I used to sleep in the clinic. I would clear the patients, sleep for 10 minutes, then go back and go be productive. And it's fine because you understand it's seasonal. It's something that is going, and you even have a time frame. It's 9 months and that's it, right? So when you look at it that way and you look at the greater good, then it becomes easier to navigate. And give yourself a lot of grace. Give yourself a lot of grace. Don't try to do so much at this time. You need to respect your body. If your body tells you you're tired, you're tired. If your body tells you need to eat, snack. If it tells you need to eat stones, know that you're lacking iron and get the right supplement for that. Walk with your doctor. Walk with your doctor. If you're here with us, we have a bundle of care. We have bundles of care for pregnancy. So we have the silver, the gold, the bronze packages. And in that, we have a midwife who works with you all through. We take the higher packages. We have a doctor working with you all through. So take advantage of these resources. Remember, you have a doctor wherever you are. That doctor has been trained and licensed to guide you as well towards pregnancy. So it's not a solo journey. We have communities. We have a very awesome online community. You can plug in that and say, today I feel tired. My fellow moms, how do you feel? And you'll realize you're not alone. But remember, it's for a short window, a very short window. So today I'd like to urge you, please, on that journal that we were talking about, there's a space that talks about what do you feel today about your body. This journal, you can journal every day and write the changes that you're feeling in your body, right? And then how do you feel about them? But remember to always say, what are you happy about? What are you grateful for? Always find, what am I grateful for? So whatever body stage you're in now, write it. You'd like to remember. If you have a food aversion, that means today you can't stand tomatoes. It's fine, write it down. Cannot stand tomatoes. And then when baby comes in the 2 years, find out, do they like tomatoes? So that it's interactive and you're not alone in this journey. Remember, you're bringing forth life. So sometimes some of the things you're seeing at the baby, you get. For example, when I was pregnant with my son, I really loved cakes. I really, really loved cakes. And now I can't stand them. And my son eats them all the time. So half the time I tell myself, it was my son who was eating for those cakes. And now I'm drinking a lot of milk. I don't like milk, So understand your body. Ask if you have a question. But beyond that, respect your body. If you start feeling like you need more milk or more of a substance like spinach or whatever, it's your body telling you, I'm lacking in this particular nutrient, and you add that particular nutrient. All right. So I hope you've learned something. Let's meet in the next session as we discuss emotional changes in pregnancy.
Life is busy and sometimes health concerns can't wait. With Wheels for Life, healthcare is just a tap away, anytime, anywhere. Whether it's a fever, a routine checkup, or something urgent, Wheels for Life connects you with licensed doctors in minutes. Get expert care from trusted doctors, specialists, and counselors without leaving your home. From prescriptions to follow-ups, Wheels for Life helps you manage your health on your schedule. With Wheels for Life, healthcare is no longer a hassle. It's fast, secure, and always within reach. Download Wheels for Life app from Apple Store or Google Play Store today. Wheels for Life, fast, convenient, and secure healthcare in the palm of your hand.